is 10:09 at WPSL 1590. The talk of the Treasure Close. And clad in his blue scrubs, fresh off the floor at Florida Orthopedic Specialist. Well, I'm not sure if he was on the floor or not. But anyway, Dr. Joe, good morning, sir.
Hey, good morning, Greg. How are you?
I'm doing fine. How are you?
Excellent, excellent. Seeing a couple patients and doing a radio show. It's a good day so far. Live from Florida Orthopedic Specialists. Our number here is 335-4770. If you want to see us up in our Port St. Lucie office off of Highway 1 and Walton Road, or same number if you want to see us at our Stewart office off of Indian Street and Willoughby in Stewart, 335-4770. And of course, if you want to give us a call this morning live on air, the number is 340-1590, 340-1590. Well, how are things, Greg?
Well, I'm doing well. So how's the double daddy? Are you sleeping at all?
Yeah. Bethany and I have been pretty blessed. Our first baby was a good sleeper, and baby Allison is a great sleeper. She's already sleeping through the night, and she's 6 weeks old.
Wow.
So baby's sleeping, so everything else is great.
Yeah, that's
as long as you have everything else is all right. Yeah, no colic, and she's sleeping. I think those are kind of the biggest issues. As long as you're not dealing with those, those are rough. And there's nothing you can do. If your baby's not sleeping and you got colic, I mean, those are just two very unknown processes in medicine. No one's got a great understanding of colic and how to fix it, outside of these old wives' tale, this bottle, that, and what's going on with gas or whatever. Yeah, we don't have a great understanding. And, like we've talked about on prior shows, sleep is one of the most complex biological processes there is. And that's why we struggle with it so much. We don't have great fixes, take this pill, do this or that. It's complex.
Yeah, it really is. And you think, I think the last time I checked, we've been having babies for around 2,000 years. and colic's been around since day one. You just think, wow, it's amazing that we haven't been able to come up with some fix, I guess.
Yeah, that we haven't stumbled on something. I mean, and say, some simple things work for this infant or that. But it's not like a broken bone, or a torn tendon. We know how to fix those things. I don't know. And it's kind of funny that we haven't stumbled upon that. And it's a very real thing. I mean, just ask parents who have kids who've had that problem. It's it's not like some other disorders where we're trying to figure out how real is it. Colic is very real.
Well, and what's weird, when you have a couple, as I did, one was colicky, the other was perfect. It's like you don't know.
Yep. Yeah. Greg, what do you want to talk about this morning? Anything that you wanted to go through, or
no? Who knows? I mean,
we talked quite a bit about like longevity medicine, sleep, supplements, which I thought was a good topic.
Oh boy, that as Joanne was here yesterday, and I was shocked that the pediatric group basically did a number on supplements. I thought, really, that was, I thought, a little strange. Or was it the AMA?
What do you mean? Remind me.
Well, it was the AMA said if you're reasonably healthy, you don't need to take supplements. And I'm thinking, wow, that's a doctor's group saying something like that.
And you said they're a pediatrics group?
Yeah, well, the pediatrics group was part of that. Yeah.
Yeah. And again, a lot of my stuff is specific to adults. I mean, early infants, it's well known that vitamin D needs to be supplemented, whether you're breastfed, pumped, whether I think infant formula, if you can get that formula these days.
I was going to say, yeah.
I'm almost 100% positive that formula has vitamin D in it. But I mean, you think if a majority of people breastfed or some kind of breast milk, they need vitamin D supplementation. I think that's about it. And like I said before, adults, I'm convinced that all adults need to be supplementing with vitamin D and magnesium. Um, I'm not convinced that all adults need to be on a multivitamin. I think most people can get the additional vitamins and supplements and electrolytes they need in a more or less standard American diet. um, and Yeah, so I'll just put it that way. That's my opinion on that, and I'm most strong about the vitamin D. Uh, I see a lot of people with stress fractures, and I see a lot of elderly people who've had osteoporotic or osteopenia related fractures, and that's weakening of the bones. You have normal bones, and then as they get weaker, that's osteopenia. That's the early stages of weak bones, and then the more severe stages of weak bones is osteoporosis. The most at-risk population is going to be postmenopausal females. And what we know is that we do the majority of our bone forming in our 20s. That's when we're going to make the strongest bones. And so I've had medical school professors say that everyone should be supplementing vitamin D and trying to build the strongest bones possible early in their 20s. And now other things that help to contribute to strong bones, calcium is another big part of that. And then the third pillar of bringing on strong bone is making the body recognize that this needs to be strong. And the way that you do that is through loading the bone, through force. We've talked before about these MMA fighters who strengthen up their tibia by kicking very hard objects with their calf. And the body understands that, okay, this bone is getting this repeat force over and over and over again. I got to make that bone stronger. And so you use natural hormones in order to tell these bone cells to build stronger bones. Our bones, many people don't realize it, are under this constant process of breaking down bone and also building up bones. The fancy scientific word is that we have osteoclasts, which are breaking down bone. We have normal cells in our body whose job it is to break down bone, but opposing them is osteoblasts, which are constantly building up bone. And we want to be on the right side of that, where those osteoblast cells are making more bone than the osteoclasts are breaking it down. And that's part how we heal fractures. It's a common thing that someone comes in to see me for a fracture. They're doing everything right. They're in the cast. And at first, that small fracture line, a few weeks later, it's much bigger a few weeks later. And that's because, oh yeah, and this is normal. And that's because these normal bone cells are breaking down healthy bone around the fracture. And the healthy building bone cells are not building it up as quick and as dense right away. It kind of builds up in a more cloudy, fluffy way at first that's not as dense, but eventually it catches up. And that's why most people are immobilized for something like 4 to 6 weeks for most fractures, because at that point, enough of that, the healthy cells are putting down new bone all around the fracture. But yeah, people may also hear, the original X-ray didn't see the fracture, but now the follow-up one does. How did they miss that original fracture? Well, part of the reason why we're able to catch it later is because the body's natural process of breaking down bone around the fracture. Some people describe it kind of like you got a pothole. And so in order to fix that pothole, you have to kind of clean up those edges. So you clean up those edges and then you put down the fresh stuff. Surgeons will do that sometimes with a cut. You have a laceration that's a little bit jagged. They'll clean up those laceration edges first, then they'll stitch everything together to make it nice and clean. The body's doing something similar. And we can see it on X-ray.
Wow. So, I think what you mentioned earlier, it really took me by surprise that your bones are really forming in your 20s. I thought it was the teens.
I mean, yeah, they're forming, in our teenage years and in our early development years, but where your most rapid bone density development is happening is in your early 20s. That starts declining as far as the acceleration of that by your late 30s. And yes, we're still have the ability to build as we age, But like I said, the most at-risk population for weak bones is going to be postmenopausal women. Now, men, that doesn't mean that that you're off the hook here. You still need to be supplementing with vitamin D2 because, like I've said on prior shows, we have studied healthy athletes who are outdoor athletes in college. Okay, these are extremely healthy, genetically gifted people who are exposed to sun and are putting a lot of forces through their legs. And the majority of these college age people are vitamin D deficient. And vitamin D is arguably the most important hormone to help us build bone. And it is very rare for someone to have too much vitamin D and to have toxicity from it. Certain vitamins we worry more about that with, but vitamin D doesn't tend to be one of them. So supplementation wise, I tend to recommend that.
Now, you also mentioned something a couple of weeks back too, magnesium in tandem with that. And yeah, I've just started that. I don't think I'd ever taken magnesium before, but yeah, I've started that as well with vitamin D. And of course, I've been taking vitamin D since I was a kid.
Yep, and magnesium is an interesting one. Not only so when someone comes into the hospital, we're very alert to their electrolyte levels. Do they have proper sodium amounts? Are they low? Are they high? Their potassium, very important too when we're monitoring someone's kidneys. And oftentimes someone will come in and their electrolytes aren't right, and so we have to supplement to get those right. But what doctors found is that the basic chemistry is right, is that you can't properly correct someone's sodium, potassium, chloride if they have an improper magnesium level. And when we check the majority of people, when they come in the hospital, they are magnesium deficient. So that's kind of burned into my brain. I honestly couldn't tell you about the research and how much of the population is magnesium deficient. But I can tell you when I was in the hospital checking people's magnesium level, the large majority of people were magnesium deficient and they were on magnesium the whole time that they were in the hospital with me. And they needed that in order to correct their other normal electrolyte levels. What the science says is that if someone has an altered magnesium level, if they are low in magnesium, you cannot get them to a proper level of sodium and potassium. And you think about people who are trying to eat bananas to try and elevate their potassium so that they don't have as many muscle spasms. Well, okay, you can do that all day, but if you have a magnesium deficiency, you're never going to correct your potassium amount. It's just the way that these positive elements work with kidney physiology. So you have to correct that one if you want to correct the other. So look at magnesium. Again, I recommend most people do that. And if your doctor hasn't checked a magnesium level, if you're concerned, well, is it possible I'm taking too much magnesium? Ask your doctor. But like I said last time, most people are going to need even with a healthy diet, are going to need, I think it's 500 milligrams or micrograms. It's a standard dose, when you have a bottle of magnesium. I think it's 500 milligrams of magnesium a day. Some people, in order to correct it, if they're really that deficient, may need 1 gram or 1,000 micrograms of magnesium daily in order to get their magnesium to the right level and then help them to stop having muscular related issues. I mean, these electrolytes are controlling everything else in our body: nerve impulses, muscle contraction. These positive ions is what they're called: magnesium, sodium, calcium. This is how we expand and contract muscles on a very elemental view, is by the proper balance of these. So it's essential to life, these proper balances. If it's off a little bit, you experience some symptoms. If it's off a lot, you die. If you have too much or too little potassium in your body, you die. I mean, that's how they give the lethal injection. I'm pretty sure it's a very high dose of potassium that stops a person's heart. So it's difficult to overdose on these, but well, let's not say that. Yeah, you can very easily overdose on potassium. But focus on your magnesium. It's
there
difficult.
You go. Yeah, and then talk to your general practitioner along the way too, which is in the 2.5 minutes that you get to spend with them.
Opinion. Checking the lab test. Hey, doc, can you make sure you check my magnesium, while you're talking about your other electrolytes? That's easy. And they don't mind that. I was mentioning before, this kind of all comes back to bone health. And one of the most natural ways to strengthen your bones is to make sure that you have enough force going through it. If you're sitting on your couch all day, your low back, your hips, your legs, your knees, all of these bones, they're not experiencing regular forces. And so if your brain sees, okay, these bones are just sitting around with all these good nutrients and there's barely any force going through them, these breaking down cells are going to win the battle against the building up cells within your bones. And you're going to get weaker bones, which means osteopenia, which means osteoporosis. And then, when and if you have a small trauma, you can break that. Now, and we also see this with healthy athletes too. If you don't have a proper amount of calories and of vitamin D, and you're doing too much force through these muscles, through the bones, excuse me. Now, let's say that you have a healthy 20-year-old and she's taking up a program to try and increase her running endurance. And she does too much, too quick. Maybe she hasn't run at all and she starts running 5 miles a day, says, okay, I'm doing great. Now I'm going to run 10 miles a day the next week, and the following week is 20 miles a day. They're going to get a stress fracture if you advance too quick. You need to give the body time to respond to the forces and demands that you're telling it about. But if someone safely increases their forces, slowly increasing over the course of months, then that's going to be the amount of time that the body needs to build up the strength of that bone. Think about it, how we think in orthopedics, when you need to give the body a chance to catch up and heal a bone, that's 6 weeks. So, and then to fully heal up a bone for most people is 3 months. So between 1 and 3 months is how much you need to give your body time to respond to build bone. It's a very reasonable estimate. And it doesn't hurt you to go slower. You really can't go too slow unless, of course, you don't advance at all. But that's the way these elderly women should be building up their bone strength, not just with medications for osteoporosis and osteopenia. You need to be putting force through it. Regular weight training, regular walking, so that your body says, okay, I still have a purpose for these bones. I need to build up their strength even more. And it may seem almost just too simple to say, well, I got severe osteoporosis and you're telling me to walk? Yes, that you have to. That is the long and short of it, and you may need medications too. So, we talked with Dr. Bethany on a show previously because a lot of people are afraid of these osteoporosis medications because they read on the bottle or they hear that there's this feared side effect that they could have osteonecrosis of their jaw if they take some of these osteoporosis medications. But when you really look at how rare it is for someone to get osteonecrosis, necrosis means dead, dying bone. So for a person's jawbone to die away from this, number one is these people are unhealthier people. And number two, even among the unhealthy people, I mean, we're talking 1 in a million type stuff. Well, it's actually 1 in like 100,000. But the other thing that you notice with these people who have diabetes and are overweight and have lung issues is it's not so much, it's that, but it's also that these people have very poor oral hygiene. Surprise, surprise, you're going to have a problem with your jaw as a side effect of this medication if you're not brushing your teeth, flossing, and all of these other things that doctors recommend that are part of good oral hygiene. That is one of the strongest risk factors for having this side effect from the osteoporosis medication is that you don't have good oral hygiene. So I look at it less of a medication problem and more, we just need better patient compliance with these good, healthy human behaviors. And then you're much less likely to have these side effects. Well, there's my big rant again, Greg. How'd I do today?
No, that was great. And what's very interesting is that I know you guys have addressed, oh gosh, it may have been years ago when you and Dr. Rob were talking about some of the medicines that maybe 20 years ago that they would give women for osteoporosis to hopefully eliminate the possibilities of getting it. but in a way, it was actually, later in life causing some major problems.
Yep. Yep. I'm having a tough time remembering some of the details of those medicines. I think Dr. Rob did a deep dive on that, but uh, yeah. So yep, osteoporosis, take it serious, people, because again, we see those feared side effects of it. And yes, stress fractures, compression fractures, and fall related things. And some people say, well, okay, I'm just not going to fall. All right, great. That's a good plan, but people fall as you get older. So you need a backup plan. You need stronger bones. You need to focus on your balance. If you have an injured joint, let's say that you have a chronically bad knee or ankle, you need to be addressing that, because if you have a weak link, you are much more likely to fall because you can't properly stabilize yourself. So you need to be getting active knee arthritis treatments or ankle arthritis treatments, going to the physical therapy to build up the muscle. And right, people say, well, I'm older, I can't build muscle, I can't be strong and balanced like I was as a teenager. It's true, but you can get better than you're currently at, and that can be enough to save you from a fall and a broken bone. And heck, we all know if you break your hip, that things are not so good. If you fall and break your hip, that's it's not going to end well for you. So everything that we can do to stack the deck in your favor needs to be done. And yeah, a lot of this is hard work. Some of it's just the work of coming into the doctor's office and getting a shot with me to help improve that weak link. So
Sure.
take it serious.
Well, I was watching the baseball channel, and this player that apparently has come back and, had ACL problems. And it was like a routine double. And he was between first and second. And he went down like he was shot. And it was that same right knee that apparently was operated on last year. And, you just think, gosh, they've got the best trainers in the world. And somehow, some way, it just wasn't strong enough for him.
Yeah. And we can theorize about why exactly a person like that, who is a genetic, just almost near perfect genetically to be at that level, who has the best trainers, the best regimen, the best diet, and all that. How something just like running a base, how are they going to have that tissue? Let's say that it was an Achilles, that they popped. How does that just happen out of nowhere? Right? Maybe they have a past medical history where they had a problem with that leg, but this happens with other people too. And my guess is the way part of this happened is almost like I was talking about with a young, healthy runner who is just overloading their body with too much forces. If a person is feeling the demands of a very long season, and you're putting a lot of demand on their Achilles, for example, and day after day, not giving the body enough chance to catch up, to build up that tendon, and to make sure that tendon has enough strength, you're overloading that tendon. And so what the numbers say is, out of healthy people who are tearing a tendon like their Achilles, 2/3 of them have an underlying tendonitis issue, meaning that the tendon is being overworked. And what the key part here is, 2/3 of these people, 66%, they don't have any symptoms of it. They're not going into the trainer with any kind of regular pain. They're not talking to their doctor about any kind of pain because they're not having any symptoms of it. This is going on under the surface, completely unaware to you. And then it's weakened when you are overloading the tendon. It's weakened, and then boom, it can just snap. And bones can do that. If you're overloading the bone, it can have a stress fracture, boom, just like that. I was mentioning osteoporosis and osteopenia. One of the complications that these people get is they get compression fractures in their back, where the bone compresses on itself. It just kind of collapses in. And for these women, what we say all the time in the textbook is that the women, it takes something as simple as a cough, a sneeze, bearing down like you're going to the bathroom, that increases spinal pressure. And just those simple forces right there make you have that compression fracture. I mean, that's so simple and silly, but it's true. If you have osteoporosis, and something as simple of an act of bearing down to go to the bathroom, that can create a compression fracture, and that is not rare. So I mean, that's a pretty simple force. So it just tells you how serious it is to take it. And the athlete, what can your athlete do to avoid overloading their tendons? Well, it's not taking time off in the off season. Yeah, it's taking a break, but it's slowly building your body. Well, number one, it's after the season's over, giving your body a chance to rest and fully recover and build up slowly from there so that your body is ready for the demands of that next season. People who show up, Greg, you'll have to remind me who the news says doesn't really show up for these off-season workouts, and they come in, they're a little bit lazier and not in shape. These people are more prone to injury. I forget which players that
Well,
is.
you think about it though, back in the day, and this would have been when the dinosaurs were still roaming the planets. That's but like the old baseball players, they would come to spring training to get in shape. Well, that's not the case anymore. I mean, these guys work, with millions on the line, they're working out all the time. But, what we've noticed in like some of these quote unquote voluntary camps in the NFL, guys are getting hurt already, like serious season ending injuries. And you're thinking, good grief, these are your elite athletes. And there's been more than a dozen major football players that have already gone down. And that's weird. It's back in the day, and this would have been an NBA thing, and actually a little bit baseball too, where there were some coaches, I won't name a name, but he coached at Utah. And, and so
bad human being who's gotten fired. I think I may know who you're referencing. Yeah.
but I mean, he was known to run his players into the ground at practice. By the time they get to the game that evening, they're done. Mm-hmm. And then they wonder why they're losing. And so they started backing off. And I remember having this conversation with Pat Riley a lot. And it's like, and he was one of the guys that used to really push the Lakers. But then he started backing off a little bit. And the more he backed off, the more successful he got. And so, it's there is that balance like you've been talking about.
Exactly. It's finding that right balance. I mean, you want to be able as an athlete to put, or as a human, to push your body to its full potential. And if you don't build it up slowly, if you sprint and train too much, too quick, then you're just more prone to injury. And it doesn't mean that by doing these preventative things that you're going to not get injured. But I mean, there's no, take some of the most least injured, best longevity athletes, Tom Brady and LeBron James, they are taking care of their body and they train all year round. They're doing their rehab. And look, they're some of the most uninjured athletes there is. I mean, LeBron James has had an ankle sprain recently, when he's almost 40 years old, and he had that one hip problem. But outside of that, he's been pretty healthy and a very long career, he's on 20 years. Brady, he's going on more than 20 years in the NFL. Yes, there are other people who are doing the exact same program and maybe not having the same outstanding results. But like I said, part of this is luck too. But you can just do everything you can to be smart and stack the deck in your favor.
When you were at the Bucks, what was their philosophy as far were their practices like really hard? Were they just kind of medium?
I'm looking on my wall there. The guy who I have a signed helmet from the guy. Do you remember who's the Rutgers head coach who came over to the Bucks? He was there for a couple years. He was the same guy who was at the very end of the game when the opposing team would take a knee. His players would blitz as hard as they can and try and knock the quarterback down. And there was all this controversy. He was a tough-nosed guy.
Is that Sperano? Maybe no.
No, but I don't. No, not him. Yeah. So
I think I know who you're talking about. I just can't even think. I can't think of it though.
Yeah, and so he was very hard nosed, and people worked hard all the way through the end, even though he caught some flack for it. And so yeah, they were tough. Now, when I was there, that was back 2012, 13. Uh, they were making they were making some significant progress with MRSA MRSA reduction, and they were starting to implement a little bit more of the sports science, specifically with hamstring issues. Hamstrings can be extremely preventable if someone's on the proper hamstring rehab program. um, NFL trainers and players have been a bit slow to adapt the program that helps. It's a certain type of exercise called an eccentric exercise. If someone's curious about this at all, you search Nordic eccentric, ECCENTRIC, eccentric exercise. And it's a certain way of loading the muscle and tendon that helps to build tendon health. And this is something that should be done with all kinds of muscle building. There's a certain way that you trick the tendon into stimulating more repair cells and healing cells. And so this is something new, but trying to tell athletes that have been working out forever, or trainers that have been indoctrinated after years and years of, hey, this is what works best. And it's a very controversial kind of business too, just kind of like nutrition. What kind of nutrition is best? What kind of strength building and injury prevention is best? Trying to tell them that they need to do things in a certain way that's different than they know it's difficult. And so getting the NFL and trainers and players around to certain concepts has been tough. But it's slowly making its way in, and it helps when you have people like LeBron James and Tom Brady who follow these programs. People will buy in, and I can tell you for a fact that part of LeBron James and Brady's programs are eccentric training of their muscles. So
That's interesting. Yeah. Well, and you mentioned diet, and I remember when our morning guys had when we first joined the Dolphins radio network on PSL, and had a young lady who we met, Carol and I met down at the Dolphins facility, who was the dietitian, and she she was telling us about one of the players who she had her hands full. It was like, this was a kid that, would have 10 Big Macs a day. And he was always getting hurt, always. And the trainers just finally threw up their hands and said, can you work with him? And she said, oh yeah. And then they started doing the diet, not a diet per se, but you know what I'm talking about, really good foods. And so he would do that. He was getting a little better. And then come to find out that he would go out at midnight, break curfew, and go to McDonald's and get about 4 or 5 hamburgers at night. And it's like, and it just like, it was tough. And supposedly, from what I hear now, and I think he's been playing for 10 years, oft injured, but that he's finally got the message.
Yep. And it doesn't help that you have some of these athletes out there like Marshawn Lynch. He was the guy famous for having a bag of Skittles on the sidelines, or Lamar Odom, who would talk about how many candy bars he eats in a day. Or I think recently DK Metcalf, one of the wide receivers, talks about how much candy bars they eat and what their diet is. I mean, these people, I think part of it's a bragging thing. Hey, I'm so good. I work so hard. I'm so genetically gifted and better that I can be at this level despite me eating all these other things, is my guess. But the majority of people, you can't be doing that. You can't be doing that unless you're that genetically gifted. And even still, you could be doing far better if you were following the right program. How much better could DK Metcalf be, or Marshawn Lynch be, if they were on the LeBron James or Tom Brady program? A lot better. Maybe Marshawn Lynch would still be in the league. Hey, maybe Pete Carroll would have given him the ball on the goal line, to pound it in against the Patriots.
Yeah, well, I remember years ago when Brady was just attacked for his weird diet, and you remember those days, and the people are making fun of him and stuff like that. And here he is 10 years later, still playing in his mid-40s.
Yep. And there are some things that he does. So I looked into the TB12 program, and a lot of the stuff I agree with. It's maximizing sleep, it's minimizing alcohol and other drugs, it's mental health, it's meditation. But part of the thing that was weird that I couldn't quite get on board with was he and TB12 believe that you should only be taking in a certain type of macronutrient at a time, meaning you should only be eating fruit in one sitting. You shouldn't be mixing that with meats and vegetables. So, and their thinking, and I'm not aware that there's any research behind this, is that your body will better process the fruit in your stomach and in your gut, and it will go in more clean, and your body will just be happy dealing with one thing at a time, just dealing with fruits, just dealing with those types of sugars that come in fruits, and not be complicated by, let's say the protein from a cow, while it's also trying to digest that fruit. I'm not aware of any evidence that says that that's true. It's very difficult to eat in that way. I can't imagine, only only having a dinner of fruit, and then whatever 5 hours later only having a snack of whatever else, vegetables. It's very difficult to do, and I'm not aware of anyone else who really follows that diet program. So yeah, that's kind of an odd thing, and hey, maybe there's some truth to it, or maybe it actually works. But I think the rest of his things are what's giving him the results. The mental awareness, the sleep focus, and the injury prevention exercises that he does, and alcohol reduction. I think that's
Okay, I got a question for you. You mentioned that diet. What about you hear about athletes that are into like vegan stuff, and are they getting can you get on a vegan diet enough protein to make things work right?
Yeah, and so vegan eaters, they're quite aware of that protein issue. So there is ways for them to get enough protein. Um, Sometimes the problem with the vegan athletes is just the amount of certain foods that you have to consume in order to meet the metabolic, the energy needs for someone who is pushing their body to the extreme and working out that hard. I mean, you have to consume a lot of vegetables to get, enough of the protein, enough of the fats, uh, and enough of the calories to support your muscles and bones. So that tends to be a bigger issue for the athletes. And kind of full circle, what we were talking about before was people getting stress fractures. We see it all the time in it's really college age females. They do a lot of working out, but they're not consuming enough calories. And if you're not consuming enough calories, well, your bones aren't going to be healthy and your muscles aren't going to be healthy, and things are going to tear, things are going to break. It's something called the female athlete triad, where they actually get osteoporosis. These young females have weakened bones because they don't have enough energy coming in and they're expending so much. So so that's more of my concern with vegan athletes is, are you meeting your caloric demands? For someone who's otherwise vegan and not working out to that level, they're probably going to be fine. But you just need to be aware of what your potential deficiencies may be. Like you said, a lot of people know with vegans, it's protein. It's vitamin B things. People who are on a ketogenic should know that if they're not aware, they may be deficient in selenium, a type of element that you get in non-ketogenic foods. One of the best ways to get selenium if you're on a ketogenic diet is to eat some Brazil nuts. A little bit of FYI education for people out there: don't overdose on the Brazil nuts, because if you do, you're going to have terrible acne. So I mean,
Oh no.
oh yeah, yep, you'll break out. You will break out. But I mean, Brazil nuts, they're pretty big. I mean, they're probably a bit bigger than the size of of like your thumbnail, a little bit more than that. I mean, the recommended amount is to eat somewhere between 4 and 6. I eat Brazil nuts and I don't want to have a terrible acne breakout. And so I make sure I don't get anywhere close to the 6 or more. But you do want to make sure you're getting enough selenium if you're on a ketogenic, meaning a low carb diet. So there you go. So if you're on a weird diet, or if you're on a diet, do some research and find out, hey, what am I more likely to be deficient in? What kind of problems? Is it vitamin D? Is it, is it protein, whatever?
That's wow. That's very interesting. And that's stuff that, I never even would think about. Yeah, boy, this has been an educational hour here. You've been,
the Atkins diet, the ketogenic diet, the low carb diet, it's becoming more and more popular. And so you don't want to have any unintended consequences from that. So, so do your research. People already kind of research their diets enough, but you want to look out for, hey, when you're following it properly, what kind of problems could you run into, and avoid those.
Yeah, and as you and of course Dr. Sellards and Dr. Powers have said for many years, you just got to watch the body mass index, and I think we're all getting aware of the magic number that you just can't cross, or else you guys as orthopedic surgeons can't help them if they're really heavy.
We're fighting a complex process here. A lot of times we're fighting age, and Mother Nature, age, it wins. It wins this war, and so we're fighting our best to push against it. And so you got to do your part. Proper exercise, the proper dieting. Working on those unhealthy behaviors, because otherwise you're going to make it much more likely that age and Mother Nature are going to get to you that much sooner. We have some things, so when someone's knees get flared up or whatever, we have our medicines, which help to kind of push age and Mother Nature off a bit, anti-inflammatory reducers, cortisone shots, these are great. But when you put all your eggs in that basket, it's not going to last very long before Mother Nature is going to, to chew through that too. And we're back to where we started. And now we have even less options. In someone who's overweight, relying on their cortisone shots, in their 40s and 50s, doing some of the improper things in their 40s and 50s. Well, if you're relying on the cortisone shots for 10 years, 20 years, putting on weight, well, good. What's going to help you to have some pain-free joints, 20 years down the road when you haven't worked on those healthy behaviors? So now is the time to start and use use our great medicines, our great interventions in order to reduce your pain so you can do the right things. That's the proper way to do these things. And we're going to get injured. These things are going to happen, but learn from the mistakes and use the medicines and improve. But unfortunately, not enough people do. But that's okay. We'll do the best we can for you. It just stinks, when we run out of options, and a person's coming to me and they're saying, cortisone's not working anymore. Your gel shot, it was working. Now it's not working anymore. The anti-inflammatories aren't working anymore. And then we're stuck. And the person's maybe, got diabetes and they're not a good surgical candidate now, or they have kidney problems. And I just hate it when I can't help you anymore. So kind of like, Jerry Maguire, help me, help you. Was that Jerry Maguire? No. You'll have to remind me of that, where that quote from. Help me. Help
I forget. Yeah, I think it was Jerry Maguire.
Because we want to help.
Who Jerry Maguire really is. It was Lee Steinberg.
Oh, it is. Okay, I was going to guess.
Yeah, Lee has been a friend forever, and that was Lee back in the heyday. Believe me.
Yep. Great classic movie.
Oh yeah. That's one of our classic bus movies at IRSC that we managed to see.
How about a little Brian Song? Brian Song's a great guy movie. Yep.
And
of course, it's one of the classic guy crime movies. Kind of.
Yes. Like, yeah. It and James Caan was great in that. R.I.P. to James this week. Mm-hmm. But Brian Song was a classic movie. It really was.
Really unbelievable what he was able to do too. Having active cancer, and overcoming that and coming back, similar to like a Lance Armstrong type thing, how do you have active cancer? I mean, he had lung cancer, I think, Brian Piccolo, right?
Yes, Brian
That-
Piccolo. Yes,
yeah,
Chicago Bears.
yeah. That's unbelievable. I mean, there is some genetic giftedness there. I mean, to overcome a cancer and get back to a pro level. Yeah.
Yeah. Oh, yeah. And gosh, that baseball pitcher, I guess, that has come back, and he was at one point stage 4, which was amazing. And he's back pitching again. I'm thinking, oh my goodness. Yeah. It's amazing. But we got about 5 minutes left. What are you seeing a lot now at Florida Orthopedic Specialists?
Good question. Well, funny, funny ask, Greg. We're a lot busier than normal, and I'm seeing a lot more of those snowbirds who have moved down here permanently. So I'm seeing a lot of your standard stuff. Not as much in the wintertime. We see a lot of people falling. We see people coming from the north. They fell on the ice, or they were, traveling or whatever, and they injured themselves traveling, coming down. We see a lot of that. But right now, I'm seeing just a lot of your standard arthritis, tendonitis issues. And I'm also seeing part of it too. People for a long time weren't coming to the doctor because they were afraid of coronavirus, and now they're not so much. And now they're addressing some of these chronic issues that have been going on for 2+ years. So yeah, it's when your pains have been going on that long, there's no reason why you should be suffering in pain. You're not bothering me. You're not wasting my time with minimal symptoms. I'm always happy to provide you with some guidance, even if it is bothering you minimally. But if something is bothering you on a daily basis, it's impacting your quality of life. You don't have a diagnosis. You don't have a plan for it. Come in, talk it out with us, and most importantly, take our information seriously and apply it, and watch it improve on your quality of life. I see way too many people who are sitting on chronic injuries for multiple years and just aren't doing anything about it. I don't know what to tell you. You only live once. Why waste years of being in pain? You're not wasting our time with minimal pains. So come and get our opinion on it. If you don't like our opinion, you can always get another. If a surgeon tells you, maybe you don't come here and you come to someone who just wants to cut on your knees. Well, if you don't like their opinion, get another opinion. There's always something that can be done non-surgically. Unless, of course, like I said earlier, we've exhausted all of your options, but there's always something that can be tried non-surgical.
Yeah, and and I think the key there too is the fact that if all of a sudden you go to an orthopedist who says they want the first option is cutting, you better get up and run. I think
it's got to be extremely rare, and Dr. Southard and I were talking about it one time, that it's extremely rare that he would have a patient come in to see him, and on that very first visit, him recommend surgery and do not pass go. Just it's surgery as his first recommendation on that very first visit. That just really shouldn't happen. Now, if you were working with another orthopedist and you were specific and you were getting some treatment and you weren't getting better, and now you're going off to meet the surgeon specifically because the non-surgical things aren't working, well, that's different. And so when Dr. Southard works with me, and for years I've been doing some injections for some shoulder arthritis, and it's not working, well then, yeah, with those people, it's normal for on a first visit for you all to decide on a surgery. But yeah, it should be a getting to know you process. You should feel comfortable with the surgeon before just jumping down that surgical path. For the most part, certain fractures, tears, certain things break that rule. But I'm talking 95% of the time, it should be that way, where the non-surgical thing, the get to know you process, building trust and confidence happens, and hopefully we get through that and get over it without any surgery. Yeah.
Yeah, and then after you've done that and taken all those steps, then the logical thing would be surgery. But yeah, if that's a first mention, Oh boy, that's not good at all. That's not good at all. Well,
And Greg,
doctor,
another common thing that I hear from people too is, well, so if I may need surgery someday, why don't I just get it done right now? Well, surgery has complications. 1% of people, get an infection from a surgery. Do you want to be 1%? Do you want to be 1 in 100 who gets, IV antibiotics and stuck in the hospital and has kidney failure, all related because you jumped to a surgery quicker than you should have?
yep.
Maybe you're going to get that surgery, in your lifetime. Maybe it's going to be 5 years later, but wouldn't you like to have 5 great years instead of jumping to something that could have a disastrous consequence? So we always want to avoid that if possible. All right, and I know we're running out of time here, Greg, but yeah, great bone talk. Again, our number for Florida orthopedic specialists is 335-4770, and I'm Dr. Joe Wiersbecki. You can also find me online at drw.org, doctorw.org. Thanks, Greg.
All right, you have a real good week, Dr. Joe. Dr. Joe, Florida orthopedic specialist with Bone Talk. Boy, now in its 15th year here on WPSL. Fort St. Lucie.
This is CBS News on the Hour, presented by Indeed.com. I'm Steve Kathan. Another day, another jarring report on inflation. The government says prices at the wholesale